Bipolar disorder is sometimes called manic depression or bipolar affective disorder. About 1 in 100 people develop this condition. Although the symptoms and severity vary, bipolar disorder almost always has a powerful impact on those who have the illness, as well as their family members, partners and friends. This guide is intended to answer some of the most commonly asked questions about bipolar disorder.
What is bipolar disorder?
Bipolar disorder is sometimes called manic depression or bipolar affective disorder. In this condition, you have periods where your mood is in one extreme or another. One extreme is called depression, where you feel low and have other symptoms. The other extreme is called mania or hypomania if symptoms are less severe, where you feel high or elated along with other symptoms. The length of time you spend in each extreme may vary. You can have a number of episodes of highs and lows throughout your life. In between highs or lows, there may be gaps of weeks or months or years when your mood is normal. Depression. In a major depressive episode, the following symptoms are present for at least 2 weeks and make it difficult for a person to function. Loss of enjoyment and interest in life, even for activities you normally enjoy. Abnormal sadness, often with weepiness. Difficulty in sleeping or sleeping too much. Feeling guilty, worthless or useless. Poor motivation. Problems concentrating or making decisions. Low mood for most of the day, nearly every day. Lacking in energy, always feeling tired. Difficulty with affection, including going off sex. Poor appetite and weight loss. Sometimes the reverse happens with comfort eating and weight gain. Being irritable, agitated or restless. Feeling slowed down or guilty or having low self-esteem. Thoughts of suicide or death. Life's not worth living. In severe cases, there can be psychotic symptoms, hallucinations or delusions. Mania. Mania often begins with a pleasurable sense of heightened energy, creativity and social ease. However, these feelings quickly progress to full-blown euphoria, extremely elevated mood, or severe irritability. Very often, a person with mania can often deny that anything is wrong and angrily blame anyone who points out a problem. In a manic episode, the following symptoms are present for at least 1 week and make it very difficult for a person to function. Feeling unusually high, euphoric or irritable. Grandiose or unrealistic ideas about yourself and your own importance. Needing little sleep, yet having great amounts of energy. Talking so fast that others cannot follow you. Flights of ideas. This means you tend to change quickly from one idea to another. You may feel that your thoughts are racing. Full of new ideas or plans. Often the plans are grandiose and unrealistic. Doing reckless things without concern for the consequences, e.g. spending too much money, inappropriate sexual activity, or making foolish business plans. Taking part in risky, exciting adventures. In severe cases, the person may experience psychotic symptoms, such as hallucinations, hearing or seeing things that are not there, or delusions, firmly believing things that are not real. Usually you do not realise that you have a problem when you are high, but as the illness develops to others, your behaviour can be bizarre. Family or friends tend to be the ones who realise that there is a problem. But if someone tries to point out that you are behaving oddly, you tend to become irritated, as you can feel really good. Hypomania. This is a milder form of mania that has similar but less severe symptoms and cause less impairment. During an episode, the person may have elevated mood, feel better than usual, and be more productive. These episodes often feel good, and the quest for hypomania may even cause some individuals to stop taking medications. However, hypomania can rarely be maintained indefinitely, and is often followed by an escalation to mania or a crash to depression.
When does bipolar disorder begin? Bipolar usually begins in adolescence or early adulthood, although it can sometimes start in early childhood or as late as 40s or 50s.
What causes bipolar disorder? There is no single proven cause of bipolar disorder. Research suggests that it is a result of abnormalities in the way some nerve cells in the brain function or communicate. Whatever the precise nature of the biochemical problem underlying bipolar illness, it clearly makes people with the disorder more vulnerable to emotional and physical stressors. As a result, upsetting life experiences, substance abuse, lack of sleep, or other stressors can trigger episodes of the illness, even though these stressors do not actually cause the disorder. Is bipolar disorder inherited? Bipolar disorder tends to run in families. Researchers have identified a number of genes that may be linked to the disorder, suggesting that several different biochemical problems may occur in bipolar disorder. How is bipolar disorder diagnosed? The doctor diagnoses the illness based on a group of symptoms that occur together. To make an accurate diagnosis, the doctor will need to take a careful history of the symptoms the person is currently experiencing, as well as any symptoms he or she has had in the past. How is bipolar disorder treated? Medication is necessary for nearly all patients during acute preventative phases. Education is crucial in helping patients and families learn how best to manage bipolar disorder and prevents complications. Psychotherapy helps patients and families deal with disturbing thoughts, feelings, and behaviour in a constructive manner.
What is the best treatment for bipolar disorder? The three most important types of medication used are mood stabilizers, antidepressants, antipsychotics. Your doctor may also prescribe other medications to help with insomnia, lack of sleep, anxiety or restlessness. While we do not understand how some of these medications work, we do know that all of them affect chemicals in the brain cells, neurotransmitters, which are involved in the functioning of nerve cells. You have to take a combination of medicines, and it's very important to get that combination right, because if the medication is not right, the symptoms will keep on coming back. So it depends. Different people need different medication.
About hospitalization. Many patients with bipolar disorder are hospitalized at some point in the course of their illness. Because acute mania affects insight and judgment, individuals with mania are often hospitalized over their objections, which can be upsetting for both patients and their loved ones. However, most individuals with mania are grateful for the help they received during the acute period, even if it was against their will at the time. Hospitalization should be considered under the following circumstances: when safety is in question due to suicidal tendencies or aggressive, impulsive actions; when severe distress or dysfunction requires round-the-clock care and support; where there is an ongoing substance abuse to prevent access to drugs; when the patient has an unstable medical condition; for close monitoring of effects or side effects of medication. Individuals with bipolar disorder are often tempted to stop taking the medication for several reasons. They may feel free of symptoms and think they don't need medication anymore. They may find side effects too hard to deal with. They may miss the mild euphoria they experienced during hypomania episodes. However, research clearly indicates that stopping taking maintenance medication almost always results in relapse, usually in weeks to months after stopping. In the case of lithium, there is greater evidence that stopping in an abrupt fashion carries a greater risk of relapse. Therefore, if you must discontinue medication, it should be done gradually under close medical supervision of your doctor.
Is there anything I can do to help my treatment? Absolutely yes. First, you should become an expert on your illness. It is essential that you and your family or others close to you learn about its treatment. Read books, attend lectures, and talk to your doctor or nurse. You can often help reduce the minor mood swings and stressors that sometimes lead to more severe episodes by paying attention to the following. Maintain a stable sleep pattern. Maintain a regular pattern of activity. Do not use alcohol or illicit drugs. Enlist the support of family and friends. Try to reduce stress. Learn to recognize the early warning signs of a new mood episode thus providing the opportunity for early intervention. Maintain and regularly take your prescribed medication. What if you feel like quitting treatment? It is normal to have occasional doubts and discomfort with treatment. Don't be shy about asking your doctor to arrange for a second opinion if things are not going well. How can I monitor my own progress? Keeping a mood chart is a good way to help you, your doctor, and your family manage your illness. A mood chart is a diary in which you keep track of your daily feelings, activities, sleep patterns, medication and side effects, and important life events. Often, just a quick daily entry about your mood is all that is needed. Noticing the changes in sleep and stressors in your daily life may help you identify what are the early warning signs of mania or depression and what type of triggers typically lead to episodes for you. What can families and friends do to help? Family members or friends of someone with bipolar disorder can help by being informed about the illness and treatment options. Learn the particular warning signs for that person, which indicate that he or she is becoming manic or depressed. Talk with the person while he or she is well about how you should respond when you see the symptoms emerging. Caring for someone with bipolar is a long-term commitment. It can be difficult at times. Here is a list of suggestions that might help you keep a positive long-term attitude. Separate the disorder from the patient. It is important to recognise when someone's behaviour may be a result of their illness and not their normal personality. Be realistic. Encourage the person to see a doctor to continue with treatment and avoid alcohol or illicit drugs. Try to be patient and understanding. If your loved one becomes ill with a mood episode and suddenly views your concern as interference, remember that this is not a rejection of you, but rather a symptom of the illness. Learn the warning signs of suicide and take any threats the person makes very seriously. Both you and the person need to learn to tell the difference between a good day and hypomania and between a bad day and depression. People with bipolar disorder have good days and bad days, just like anyone else. With experience and awareness, you will be able to tell the difference between the two. Take advantage of the help available from support groups. Look after yourself. Supporting someone with bipolar disorder can be exhausting. Put some support structures in place for yourself and be sure to ask help from your healthcare officials if life becomes difficult. Supporting someone with bipolar disorder is a long-term commitment. At times, your loved one will reject your offers of help. However, it is important that you reassure them that you will be there for them. Psychotherapy. Talk therapy can help a person cope with life problems, come to terms with changes in self-image and life goals, and to understand the effects of the illness on significant relationships. Counselling and talk therapies may help prevent both mania and depression by reducing the stresses that trigger episodes and by increasing a person's acceptance of the need for medication. There are various forms of psychotherapy, and these approaches are particularly useful during acute depression and recovery. Living with bipolar disorder.
When I'm high, I feel great. I have loads of energy and want to do loads of things. I sometimes spend too much money though. I'm much more sociable and I call to see everybody that I wouldn't normally do.
What's it like when the high starts to wear off?
I start to get really tired and really irritable and angry.
Would you get much sleep when you're high?
No, I don't get much sleep, maybe 3 hours sleep a night. And when I'm up, I'm constantly active and doing things, cleaning the house and decorating the house. And
how long does a high last for?
It could take 2 or 3 weeks, sometimes longer, sometimes less.
How long does a low last for?
That can last longer. That could be a couple of months.
How do you feel after a high has ended?
Absolutely worn out.
How would your family notice you were going into a high?
They'd notice the excitement in me and my speech changes. I would start to speak really quickly and without much break.
How would your family notice you were going into a low?
I'd withdraw, like I wouldn't be in touch with anybody, and my mood would obviously be low.
Yeah.
I just want to be on my own. I don't want to talk to anybody or see anybody, and like kind of take to the bed then. As I said, it could be weeks in bed.
It is important to remember that with the right management, people with bipolar disorder can lead successful and fulfilling lives. It is hoped that this short film will be of benefit to you. However, should you have any questions, please feel free to ask your consultant or nurse. Being informed is the surest path to success.